And now in other news, Israel is gearing up to launch its 5th vaccination campaign against the coronavirus, with the new shots adapted for the Omicron variant. Joining us now with more on this effort is the director of the School of Public Health at Ben Gurion University, Professor Nadav Davidovitch. Thank you for joining us.
Thank you.
So first of all, what will Israel's 5th vaccination campaign look like?
Actually, it's timing of the winter preparation, so it's a perfect timing. We have now a better vaccine, a vaccine that is bivalent, meaning not just the original strain, but also Omicron. We're talking about BA4 and BA5 that were doing lots of problems in the last months. And it's good timing because we have also the preparation for the winter and the influenza. High-risk people in terms of age, obesity, high blood pressure, diabetes, all of that can get the vaccine. But of course, vaccines are not enough. We need to continue the surveillance. We need to see that people that are sick are not going to work, staying at home. We need to see that all the mental health and other wider things that are taking place, such as long COVID, are taken into consideration. And in general, strengthening the healthcare system, the hospitals, community, public health for the winter. This will be good not just for COVID, it will be good also for other upper respiratory infections. And also remembering that it's not enough to clap hands, it's a priority, it's part of our national security.
And I have to ask, first of all, what is the coronavirus situation like in Israel now? It seems very few people are ill at the moment.
COVID is with us. We have widespread infections. The difference that we have some kind of a normalization of COVID because we have vaccines that save more than 20,000 lives of people. We have drugs. We have all the system to do home care. We have home tests. So COVID is with us, but we have many ways of dealing with it. I think that we don't need to panic on one hand, but on the other hand, we need to be alert and do all the things that we learned throughout the last few years. There is pandemic fatigue, but there are many things that we can do. I'm happy that we are turning more into a normal response. So the COVID exceptionalism that we had probably need to be turned into integrating a public health response for COVID within the broader context.
Because you mentioned pandemic fatigue, and most people in Israel feel that the coronavirus is over. I mean, you see people in the streets, in shops, nobody's wearing a mask, and you barely hear about it at all. So do you really think people will go and get vaccinated now, especially considering the health ministry is also calling on people to get vaccinated with the flu shots? You're asking people to go out and get 2 vaccine shots. I mean, what are your thoughts on this? Are people going to go out and get vaccinated?
Yes, I think so. We have very high rates of vaccines among high-risk groups. Of course, we cannot take it for granted. We need to do campaigns that should be targeted to specific groups according to their beliefs, to their culture. It's not the same thing to do a campaign with the ultra-Orthodox community or Bedouin community or in the periphery or in other groups. But I think that normalizing COVID means that we need to invest in promoting vaccination of COVID and other things. There were a reduction of vaccination, not just because of COVID, but we have polio also with us and groups that are less vaccinated. So we need to invest in a way that will be sustainable. There is a fatigue, but strengthening public health systems, for example, giving more budget to people that are doing health promotion, working with the communities within the municipalities. That's something that we learned during COVID. I think also the fact that our community healthcare system is very strong, that's part of the reason why, although we had very high rates of infection, the mortality rates were lower. So there are lots of things to do, not to panic, but preparing for other public health challenges.
All right, investing in the public health system always should be a priority. Professor Nadav Davidovitch, thank you so much for taking the time to speak with us today.
Thank you. Shana Tova.
Shana Tova.
Hi everyone, it's Emmanuel Kadosh. I wanted to invite you all to subscribe to ILTV Plus, where you can find our daily news and updates about Israel. And not only that, but live feeds, entertainment, our kosher food show, and so much more. Needless to say, your subscription to ILTV Plus helps us grow and create more content while also supporting the state of Israel. Our app is available on all platforms and devices, so I'll see you guys there.